Hello, my name is Kira Smith, and I am going to talk to you about a condition known as Syndrome of Inappropriate Antidiuretic Hormone Secretion, also known SIADH. We'll simplify that. So SIADH is a condition in which the body makes too much antidiuretic hormone, or ADH. So ADH is a vasopressin. It's produced in an area of the brain known as the hypothalamus, which is located under the brain and below the thalamus, so hypothalamus, and above the pituitary gland. So ADH is then stored and released by the master gland, which is the pituitary gland. ADH plays an important role in maintaining fluid balance in the body. It works by telling the kidneys how much water to conserve and how much to expel out as urine from the body. And with the condition SIADH, ADH is produced in excessive amounts from other areas of the body other than the hypothalamus. Excess ADH results in increased water retention and less water expelled from the body. This process of retaining excess fluid volume in the body, obviously, since it's very abnormal, it ultimately throws off the body's electrolyte balance by having that much water conserved, especially the sodium electrolyte is thrown off. Because as we know, sodium is an important electrolyte that helps with regulating water balance that is in and around the cell. So causes for SIADH. There are a variety of different conditions that contribute to that. Some of these conditions can be brain infection, lung infection, head trauma, hydrocephalus, multisclerosis, Guillain-Barré syndrome, cystic fibrosis, asthma, tumor cells, and then certain cancers, medications, chemical therapy agents, anesthesia, and so on. So those are more secondary causes that are causing that, and that is probably the most common cause of SIADH. But there are some primary causes, which would be hereditary causes, and one for sure is the nephrogenic SIADH, in which individuals gain a function mutation in the vasopressin V2 receptors in the kidney. So clinical manifestations of this, symptoms may start off mild at first and then progress and become severe. So mild symptoms would be weight gain, weakness, nausea, vomiting, cramps, and then low urine output, or oliguria. Severe cases presenting clinical findings could be loss of appetite, personality changes, irritability, restlessness, confusion, hallucinations, decreased reflexes, and then even seizures, comas, and ultimately death. So complications that can occur with other systems with SIADH, so due to the impaired water retention or excretion, individuals with SIADH can experience complications associated with hyponatremia. So hyponatremia occurs when the concentration of sodium is abnormally low in the blood. So potential complications of hyponatremia can lead to headaches, memory problems, depression, tremors, muscle cramps, and then the more severe complications would be respiratory failure, seizures, coma, and then death. So if hyponatremia is severe and develops rapidly enough, irreversible neurological damage and death from brain herniation, which kind of brain's pretty much trying to squeeze out through the to the spinal cord can occur. So diagnosing SIADH is usually done through a physical assessment by a licensed physician through presenting symptoms associated with SIADH and through a urinalysis of a patient to assess for imbalances in electrolytes. So before confirmation of SIADH can be made, healthcare providers must rule out other causes, like other health conditions, such as hypothyroidism, when the thyroid's involved, and then also the adrenal insufficiency.